Hello, I am Dr. James Hall, and today we're going to talk about 7 tips to help you better manage your nephrology patients. I am a nephrologist. I've been practicing nephrology for about 20 years. I know I don't look, but that's okay. At any rate, let's jump right in. The first thing that I want you to know about managing nephrology and CKD patients when they come in your clinic, you got to check a H&P, history and physical, as well as family history. Sometimes that can give you almost everything you need to know. One of my old professors used to say, if you take a good enough history and physical, you can diagnose the patient from the history and physical. So, really be precise and be thorough when you're doing a history and physical on CKD type patients because they have a lot going on. And I know you guys know that. So always, look for the little things that they're not telling you. An old uncle had polycystic kidney disease, or my grandfather was on dialysis. One of his sons, my uncle, was on dialysis. So all these things matter when it comes to kidney disease. The other thing is diabetes. If the patient's diabetic, always check a A1C. That's the second thing. I know you guys know that, but just a reminder, check a A1C. Try to get it down to 7 or below. And also check a urine albumin to creatinine ratio. That urine albumin tells you that there's something going on with your patient's kidney if their urine albumin level is elevated. If they're hypertensive, always try to get the blood pressure as low as you can. Less than 1/3 of 80 is our goal, recommended guidelines. But I try to shoot as low as possible. Sometimes I try to shoot for 115/75 if I can in some patients. The other thing is medications. Most CKD patients have polypharmacy. They're on 8 to 10 plus medications. Please help us help our patients keep their medication levels down. I always try to maximize and optimize the patient's medications before adding another one, especially with, blood pressure and that type thing. You'd be amazed at how many patients have come in my clinic on 4 blood pressure medicines and none of them are maximized. So try your best as a primary care provider to maximize your patient's medications before adding another one and to minimize the number of medications if possible. We have an online course that we've created. Basically, it's a nephrology course that teaches primary care providers how to do what we do. It's modular based, 7 modules. There are quizzes after each module, and I've included case studies from my medical practice that will help you really, bridge that gap from what you're seeing in clinic and how we nephrologists think and how to manage these patients. CKD is very complicated because you got diabetes, you got blood pressure, you got proteinuria, you got medications, you got side effects. What do? You got gout. I can't give them NSAIDs in gout. How to treat gout. So all these are the little things that we talk about in our course. Check it out below. We have a free webinar you can also check out. So after medications, the next thing you want to do is you want to look at labs. So what labs do we check? We'll check a comprehensive metabolic panel, which looks at your sodium, potassium, your bicarbonate, your serum creatinine levels. That can cue you in on, okay, this patient may have something going on with their kidneys. The albumin level is also included on that. If a patient's albumin is low, you should always think the patient has proteinuria. In America, not too many people are malnourished. Okay, so a low albumin, don't think of malnourished if you're in America, because I haven't seen many malnourished people. It's the other way. It's the other way around. Incidentally, Mississippi is the most obese state in the whole United States. We're in the top 3 almost every year. So a low albumin is usually an indicator that you're spilling protein in the urine. You're losing albumin, you're losing protein. So you should always look at that CMP because that's important. What other labs do we check? We'll check a urinalysis. We'll check a urine to protein creatinine ratio. The difference between a urinalysis and the urine protein creatinine ratio is the urinalysis tells you qualitative. Yes, there's blood. Yes, there's protein. Yes, there's nitrate. Yes, there's this. But a urine protein to creatinine ratio tells you how much protein your patient is spilling in a 24-hour period. So you take the urine protein, you divide it by the urine creatinine, that gives you the amount of urine protein in grams that your patient's spilling in a day. How is that diagnostically helpful? Well, if the patient's spilling more than 250 milligrams, that means we need to really work on the primary diagnosis. If it's diabetes, blood pressure, lupus, or what have you. If it's more than 3 grams, we usually biopsy those patients. So I think that's a great tool that you can use in your clinic to help you better manage your patients. Uh, Other labs that we check, HIV. Since HIV nephropathy is the second most common cause of CKD in Blacks age 18 to 64, we always check HIV levels in that demographic. ANA, young Black females have a really high lupus incidence, so we always check for autoimmune disease and lupus in that population. Immunofixation electrophoresis, we check for myeloma. And there's a lot of other tests. With the incidence of genetic testing lately, we've been testing APOL1 levels and genetically testing people for some of these weird diseases that kind of pop up. So that's something you can do also in your clinic if you suspect your patient has a genetic kidney disease. And the last thing, finally, is nephrology referral. Who in the world needs to be seen by a nephrologist? What are the indications to send this patient to a nephrologist? Well, I do have a video below that you can check out that will tell you 9 absolute indicators for nephrology referral. So as a primary provider, you need to know this. And I feel like most of you guys are smart and you know who to refer, but sometimes it's good to just kind of hear from a nephrologist to kind of help support what you already know and to give you that confidence to know if you see this, boom, send it to nephrology without even a doubt. So let's review. Number 1, H&P with family history. That's the first tip to managing CKD. If they're diabetic, you got to check an A1C. The third thing, if they're hypertensive, you got to get the blood pressure down as low as you can. 130 of 8 is our goal. Check medications. You got to try to minimize the medications and watch for medication side effects. The fifth thing, labs. Always check labs because they can really just fast track what you're doing. If you see a patient with a really high creatinine, that needs to go to nephrology. Other labs, that's the sixth thing that we talked about, HIV, hepatitis A and A, and that type of thing. Finally, the seventh thing, who should we refer to nephrology? So as a primary care provider, these are some things that can really help you just, really just have more confidence in managing your CKD patients and not in, kind of somewhat ambivalent about what to do with this or this or this. So check out our class. We have a free webinar that you can check out below. Check out this online nephrology course. It's 7 modules. There are quizzes and case-based studies, in each module. So I think it will be helpful to you. And we're going to keep on doing videos. I hope that this video was helpful and provided some valuable information to you as a primary provider. Thank you for all you do. We love all our primary providers because they're on the front line. They are the first responders, so to speak. So keep doing what you're doing. Medicine is a calling, and it's not something that should be taken trivial because we have people's lives in our hands, and that should be taken really serious. So keep doing what you're doing, do the best you can, and if you need help, reach out to me in our community. Thank you. Dr. Hall will see you in the next video. Bye.